Anatomy, already you know, dates back not only from here, but dates back from the Mesurian, Sumerian civilization, 5000 BC, 3000 BC. They know, or better to say they knew. Because mummification, without the knowledge of anatomy, they cannot do mummies. The mummies doesn't mean that all the viscera are intact. If you go through the mummy in the Indian Museum, Calcutta, the body is there. Now it is gone into, it is as the bandages are removed, it becomes a skeleton. But even when the bandages are removed, the skins are very beautiful. I have seen it in my young days. And skin is beautiful, the nails, hairs are like a living thing. As if some thin, living thing is blackish, skin become very blackish, are lying on the showcase. But it doesn't mean that all the viscera are there. Yes. On processing of this mummy in their ancient days, they, through the nostrils, bring out the brains by piece, passing a forceps and cutter through the nostrils, they reach the inside of the brain, and piecemeal, they bring out the brain tissues. They remove the intestine, that's when which goes into putrefaction. Putrefaction means poche jai jeguli. They know there are certain viscera are there, certain organs are there that cannot be kept intact by years after years. So they remove it. So they know the anatomy, even they know the passage, there is a passage through the nostrils, they can reach the cranial cavity where the brain is situated. They know the incision to be given to bring out the abdominal viscera, abdominal organs. So they know the anatomy, but not in systemic way. Even the prehistoric man, they know the anatomy. When they hit a lion or a deer or something to procure their foods, they hit in the target area, in the heart. They knew the heart is there. If we hit it, the animal will kill. So they knew it, but not in a systemic way. After that, gradually, the systemic anatomy comes, and it has been found that about 500 BC, Herophilus was regarded as the father of Greek. Actually, the systemic come from the Greek, then after that the Latin and etc. Herophilus is regarded as the father of anatomy. But some books, the Hippocrates is regarded as the father of anatomy. I am not going into details that because it is not needed in your examination if you have got time. So Herophilus, that is the Hippocrates, Greek physician, who studied anatomy and speculated physiology. Some books it is regarded as the father of anatomy. This is Aristotle. Then Galen is regarded one of the pioneer of anatomy. Galen. Then the Vesalius, on his works on the blood vessels and other structures, he is also one of the pioneer in the anatomy. Here is books, and you know, he is the Leonardo da Vinci. Gradually the modern times come, he is what not, everything, every adjective you can put before his name. He is a painter, he is a writer, he is an artist, he is an anatomist, he is an engineer, everything. And his drawing is still in vogue. He has dissected anatomy. So this is a marvel man, a man who can describe himself. This is the Leonardo da Vinci. Enough contribution in anatomy. It is his drawing and dissection. in these days. How beautiful. This is the older days dissection. Previously, the bodies are gathered, not found, because it was prohibited by the churches. But sometimes bodies are stolen by the thieves, and they sold it to the anatomist. And sometimes they had also murdered person. They killed persons and sold this anatomy body to the anatomist. Ultimately, this has been no. This is the previous day's dissection, dead body. This is the in London. This is the previously the anatomical dissection anatomy hall. Still, this type of anatomy hall is found in the Calcutta Medical College and possibly in Arjikor. No, Arjikor has been now separated. Still, it is found in the Calcutta Medical College. You know, there is an first dissection done in Asia is an Bengali, Pandit Madhusudan Gupta, in the medical college. Pandit Madhusudan Gupta. This is, you know, the Gray's Anatomy, the recent edition, and he is Madhusudan Gupta. I am going, when I will go very quickly, you will know that is not needed in the examination. When I give stress, giving repeated, that is important in the examination. He is a Professor Madhusudan Gupta. 28 October 1836, Madhusudan Gupta became the first Indian to dissect a corpse. He was assisted by Raj Krishna De, Umacharan Sheth, Dwarakanath Gupta and Navin Chandra Mitra, students of the medical college. Gupta, previously, nowadays it is to Gupta. Nowadays the modern day dissection hall. Previously, I have already told you in my class anatomy. Before going to that, there is a certain terms that is a specific in medical science. That is only used by the medical person, which may not be understandable by the common people. Similarly, in anatomy, there are certain terms which are used in the anatomy. These are usually used by the anatomists, which has been years previously nomina anatomica, names of anatomy. In a conference held after certain years, they decided these names to be included in the anatomical description. So all these anatomical descriptions are according to the nomina anatomica. Previously Germany, then recently had about 170,000 terms are used in the anatomy or medical profession. But it is not possible to remember all this, and we need not to remember all this. Just to know this one. But these main anatomy starts mainly, or systemic type of anatomical reading, learning starts in the Greek and Latin area. So that the names are actually coined from this Greek literature and anatomical literature as described by them. Now it is changed. Exceptions are there. I have already told you, exception proves the rule. When there is a few exceptions, it doesn't mean it is the rule. Few exceptions are always there. Especially in our body where there is a not always 2 plus 2 is equal to 4. Right? So, exceptions are there, but mainly terms are coined from the Greek or Latin. Some Arabic there, some others English terms are also there. But mainly all the terms coming from the Greek and Latin. This anatomy, and there is a meaning behind that. It doesn't mean they took this term and called it anatomy. No. Every term has got a meaning. What is the meaning? Just know the anatomy, you can write. You can know. Anatomy is consist of ana plus tomos. Ana means up, tomos means cut or cutting. Ana in Greek word they used as a up. When we used in English up, go up, right, stand up. Similarly, Greek, without the up, they use ana. And tomos, coming from the Greek, means cutting, to cut. So, anatomy means cutting up. As the anatomical knowledge has been coined, has been gathered by the cutting up of the body, so the science relating to this call them anatomy. Because previously we gathered the knowledge only by dissection, but cutting up the body, human bodies or animal bodies, etc. So this is the term coming from the anatomy. Every term, ab, errant, ab means away, ab means above and errant means away. Similarly, every term has got meaning. You will be learned later on. So, the term anatomy coming from this word. And Latin word dissecare, from there the dissection comes, it is also the same meaning. Dissecare means the cutting up. Now, anatomy, I have already told you in a class that when a large area, we divide this area into number of small divisions. For example, India. India, suppose one say there is a citizen of India. It doesn't mean anything. From where? Whether it is from the northern area, whether it is from southern, eastern or western, there is no meaning. So, the India is divided into number of states. Now I say a citizen of India from West Bengal state. It also doesn't mean. The state must be divided into number of subdivisions, then village or towns, then street, then areas. So, division is important to pinpoint a particular area. And this division may be of different types. We can suppose, for example, you students, I have already given last day, we can divide it according to males and females. 150 students, of which 80 are male, for example, and 70 are female. We divide it. Again, same 150 students, we can divide it into according to height. Same students. But if we divide the height, some of the male female will be in one group, male female will be another group. So division is very important. So anatomy is a vast subject. So we divide the anatomy in different headings. First, the most important, which is ideal to read the anatomy, is a gross anatomy. Gross. Gross means whole. Which usually gathered knowledge by anatomos or dissecting up. Nowadays, aided up by the radiological other anatomy also. So, gross anatomy. What we read today or books, it is actually the gross anatomy. The muscle, description of muscle, description of nerves, description of vessels, description of the organs, all are under the gross anatomy. So it is the first they divide the anatomy into number one, gross anatomy. Next division, more we are interested to go more deeper. We are not satisfied by only the gross, what we see the naked eye. We want to know the deeper parts. We know the cell, organelle is found in the cell. So to know that, we cut a section, very fine section in micrometer and see under microscope, higher microscope, electron microscope, and we know the subjects better. We call it histology. Histos means tissues, logos means knowledge, knowledge of tissues. So or another term is a microscopical anatomy. And there are other subdivision of the histology also. Next, clinical anatomy. We applied the anatomical knowledge in the living persons so that we can treat them. We know the anatomical basis of certain disease. Suppose a patient, what is meant by the dysphagia? Difficulty in deglutition, mane swallowing. Why important is anatomy? Just I will give you an example. A patient comes with a difficulty in swallowing. Sir, you have come and told that it tells that, sir, I cannot swallow the food properly. I cannot swallow the rice or rotis properly. There is a very difficulty to swallow. What do you think normally? কি ভাববো? What do you think বলো? কোথায় ডিফিকাল্টি? এইখানটায় ব্যথা, সোয়ালো করতে ডিফিকাল্টি হচ্ছে। কি হবে? কোন সিস্টেমে আছে? হ্যাঁ বলো, হ্যাঁ জোরে বলো না, হ্যাঁ ফ্যারিংস অর ইসোফেগাস, তাই তো? Right? Maybe. There is an cancer esophagus, so there is an difficulty in swallowing. So you ask them to go to the endoscopy or esophagoscopy so that you can put a tube and see the esophagus. No. Esophagus is normal. Then pharynx is normal. Stomach is normal. Everything is normal. Now you are a doctor practicing and she is another doctor practicing. And ultimately she diagnosed with the knowledge of anatomy and you failed and she will be a good doctor. Why? Because if we know the anatomical relation, this is the esophagus. Just in front of the esophagus there is an heart. This is an heart, this is the esophagus. And heart consists of an atria and ventricle. And there is an enlargement of the atrium due to mitral stenosis, other cause. Heart is enlarged, atrium is enlarged, and it pushes the esophagus to make it constricted, so that there is a difficulty. Actually, the disease is a cardiac patient. She know the anatomy, diagnosed it, ask for echocardiography, 1 second diagnosis, and patient is treated. Okay. That is the clinical anatomy. There is an pain in the knee joint. Patient complains of pain in the knee joint. You go for X-ray, normal. You go for MRI, normal knee joint. Then, if you know the anatomy, before the MRI costly investigation, you ask for the X-ray hip joint. Because the hip joint and knee joint is supplied by the same nerves. femoral or obturator nerve, you know by the anatomy. So, there is a disease in the hip joint. The nerve carries this information, pain, to the brain. Brain cannot differentiate whether it comes from the hip joint or knee joint. So, brain thinks it is come from the knee joint, and he or she complained of the knee joint pain. It is known as the referred pain. So, if you know that, unnecessary, you waste about 10,000, 15,000 rupees for MRI. A simple X-ray, 200 to 300 rupees of the hip joint can diagnose this. So, this is the clinical appendectomy. Appendicular pain is referred first in the umbilicus, then to the right iliac fossa. So, this is the importance of the clinical anatomy knowing. And in your examination purpose, there is a question of explain why, 4 marks, each question. And you have to answer this type of clinical anatomy in there. Even in long questions, clinical anatomy is there. So, we know what are the branches: gross anatomy, histology, clinical anatomy, then radiological anatomy. আর আমি কুইক চলে যাচ্ছি, নলে আসল জিনিসটা পড়ানো। Radiological anatomy, by the X-ray, CT scan, MRI, nuclear scanning, PET scan, all are included within this. There is another study, embryological anatomy, development of the features. Surface anatomy, to draw the inner structures on the surface of the skin. It is included in your examination. Radiological anatomy also, it is given in your practical examination. Right? Anthropometry, measurement of the skull and other structures to know the evolutionary history of the human. Similarly, so many branches in the anatomy. What is the approach of anatomy? How to read the anatomy, gross anatomy, usually reached by 2 ways: regional anatomy and systemic anatomy. Regional means regions. When we only superior extremity, this is known as the superior extremity, this is known as the thorax, this is the abdomen, this is the head, this is the neck, and this is the inferior extremity. This is the inferior extremity, this is the superior extremity. Regional anatomy means when we read the superior extremity, we read all the things about the superior extremity. The skin of the only from this to this, the vessels, the nerves, the muscles, the bones of this part only, not this part, not this part. When you read the thorax, only the viscera, organs of the thorax, skin of the thorax, how it looks like, the breast, breast is included in the superior. Then the nerves, vessels, ribs, etc. So this is known as the regional anatomy. Another is the systemic anatomy, gastrointestinal system. It doesn't limit it to the region. When we start the gastrointestinal system, we read the pharynx here in the neck region, esophagus in the neck region, thorax, stomach, esophagus in the thorax region, stomach in the abdominal region, intestine in the abdominal region, so on, so on. It doesn't limit it to the region. All the structures present in this system, all the organs present in the system, and related nerves, vessels, etc. Where do we read? We call it systemic anatomy. So, now we are going to the most vital part of today. This is that. Anatomical position. And all we describe of the reference of the viscera, I have already told you in my practical class in the anatomical position. এটা কি বলতে হবে? সবাই জানো তো? কালকে বলা হয়েছে তো? তোমাদের সব ব্যাচই বলা হয়েছে তো? In every batch? Anatomical position বলা হয়নি কালকে? দুটো ব্যাচই তো বলা হয়েছে। তাহলে আমি আর রিপিট করছি না। কেমন? কারণ টাইমে হবে না। মানে all are referred to the anatomical position, এই পজিশনটাতে। এই what is superior, it is always superior. আবার জাস্ট এটা বুঝিয়ে দিচ্ছি, সাপোজ it is the liver. Suppose it is the liver. In anatomical position, it is the superior surface or upper surface. It is the inferior surface or lower surface. It is the posterior or back surface. It is the anterior or front surface. In anatomical position, it is the superior position. Then the person lies down in this way. It doesn't mean it becomes the back surface. Even in lying down, it is the superior surface. এই জিনিসটা ক্লিয়ার থাকতে হবে। One superior in anatomical position, always superior in every position. বলতে পারো, this superior surface is on the posterior side on lying down position. But actually it remains a superior surface. Superior surface of the liver, whether it is a lying, whether it is a back, it is superior, means superior. Whether it is inferior, means inferior, not in the anterior surface. Even when he lies down. এইটা মনে রাখবে। আমাদের all things are described under the anatomical position. Now, this is the anatomical position. And this is the supine position. এই টার্মস গুলো এখন শিখতে হবে, anatomical terms. When is straight lying down on a bed, hard bed with face up, we call it, the position we call it supine position. কি বলবো আমরা? Supine position. This is a prone position. When he looks, lie upside down, it is a prone position. When you do a back dissection of our body, it will be in the prone position. This is the lateral position. Laterally. When the right side touches the bed, it is the bed. When right side touches the bed, we call it right lateral position. When left side touches the bed, we call it left lateral position. আজকে থেকেই তৈরি, আর রিপিটেড ব্যাপারই নেই। আরেকটা পজিশন আছে, দেখা হয়নি। This is the very important position, especially gynecological practice, childbirth, operation during anal region or vaginal region, this, and also in our dissection, perineal dissection, this position is very important, where the hip is bent 90 degree, knee is also bent, and knee it's put apart and strapped on a stand. This is known as the lithotomy position. There are other position, knee chest position, other things you will learn later on. This is a very important position known as the lithotomy position. This is the squatting position, বসে থাকা. This is the knee chest position. Especially anal procedure, যখন করতে এই position very important, anal dilatation, etc. This is the Trendelenburg position, where the head end is lower than the foot end in supine position. Trendelenburg position. Trendelenburg অনেকগুলি terms. There are so many terms of Trendelenburg. Now the most important is the sagittal plane. এবার আমাদের plane is very important. Already we described some reference plane of our structures of our body. So we have to know the plane. Obviously, the three planes are very important: sagittal, coronal, and oblique. sagittal or mid sagittal plane. If one cut me like this, so that I am divided into right and left half equally, with this plane by which the cutting saw is go, it is known as the mid sagittal plane or loosely sagittal plane. ওকে যদি আমি এরম ভাবে পুরো ভাবে কেটে দিলাম যে দুটো হাফ হয়ে গেল, একটা রাইট হাফ একটা লেফট হাফ, মিড লাইন, যে প্লেন which passes to divide into right half and left equal half, we call it mid sagittal plane or loosely sagittal plane. Very important plane. এরম ভাবে ভাগ করছে, একটা হাফ মিড লাইন। Any plane parallel to this plane, এখান দিয়ে গেল, it also divides the person into right and left half, but not equally. Right half is smaller than the left half. Then this plane we call parasagittal plane. Para means away. এইখান দিয়ে একটা প্লেন ভাগ হলো, ইকুয়াল কেটে দিল, সেম ব্রেথ, উই কল ইট মিড স্যাজিটাল প্লেন অর স্যাজিটাল প্লেন। এবার আরেকটা দিয়ে যদি আমি এখান দিয়ে কাটি, এটা ছোট এটা বড়, তাহলে এই প্লেনটাকে বলবো প্যারাস্যাজিটাল প্লেন। এটা আরেকটা প্যারাস্যাজিটাল প্লেন, এইটা আরেকটা প্যারাস্যাজিটাল প্লেন, এইভাবে করি প্যারাস্যাজিটাল প্লেন। Of which the most important is the mid sagittal plane or sagittal plane. এরপর হচ্ছে coronal plane, just 90 degree of the sagittal plane. We divide the person into a equally anterior half and a posterior half. এরকম ভাবে কাটলো, শটা এরকম, sagittal plane এর শটা হচ্ছে এই, বুঝতে পারছো তো? এরকম ভাবে কাটলো, রাইট হাফ লেফট হাফ। করোনাল প্লেনের এই যে কাটছে, anterior half posterior half, and it is 90 degree to the sagittal plane. তাকে কি বলি? কোরোনাল প্লেন। কোরোনাল প্লেন। আর যদি ঠিক মিড লাইনে বডি এইটাকে এরম ভাবে কাটছে, আপার ইকুয়াল এন্ড লোয়ার লেন্থটা দুটো এক, তাকে বলি আমরা মিড ট্রান্সভার্স প্লেন। আর এনি এখানে কাটলাম এখানে কাটলাম, উই লুজলি কল ইট ট্রান্সভার্স প্লেন। এন্ড যদি ইকুয়ালি কাটি, আপার হাফ এন্ড এ লোয়ার হাফ, উই কল ইট মিড ট্রান্সভার্স প্লেন। আর যদি এরকম ভাবে কাটি, অবলিক প্লেন, অবলিক বেঁকা, তাকে বলবো আমরা অবলিক প্লেন। আমাদের রেফারেন্স স্ট্রাকচার ইজ চেঞ্জড। আরেকটা ছবি দেখতে পাচ্ছ, ভালো করে বোঝানো হচ্ছে। হরাইজন্টাল প্লেন ও ট্রান্সভার্স প্লেন। এটা হচ্ছে হরাইজন্টাল প্লেন, আচ্ছা। এরপরে টার্মিনোলজি ইজ ভেরি ইম্পর্টেন্ট। অবভিয়াসলি একটা টার্মিনোলজি জানো, if it is the midline, you have to got the idea whether it is the midpoint, midline, or axial line. So this is the right side, this is the left side. Clear? It is the right, it is the left. It is the right part of the abdomen, it is the left part of the abdomen. It is the right part of the thorax, it is the right part of the thorax. It is the right part of the face, it is the left part of the face. This is the midline. Next, প্রক্সিমাল মিড লাইন, এরপরে হচ্ছে মিড লাইনে যেটা রয়েছে এটা মিড লাইন। ঠিক তাহলে এইটাকে কি বলবো? এটা যদি মিড লাইন, এবারে হচ্ছে এটা মিড লাইন তো, রাইট? মিড লাইন এখানে দুটো আমি রাখছি, এটা হচ্ছে মিড লাইন, মানে ডোজটা দেখো, ইট ইজ আ মিড লাইন, এইখানে রাখলাম, এখানে রাখলাম। হুইচ ইজ ক্লোজ টু দ্য মিড লাইন? This remote or this duster? Remote. So this duster is away from the midline in comparison to this. If two things are given which is more close to midline, we call it medial. M-E-D-I-A-L, medial, and this we call the lateral. When you say the medial and lateral, means two things are there, comparison is there. একটা থাকলে হবে না, এইটা কোনো মিডিয়াল ল্যাটারাল হয় না, কারণ ইট ইজ এ সিঙ্গেল। যখনই দুটো আসবে তাহলে কোনটা অ্যাওয়ে, কোনটা which one is away, which one is close to the midline, to know that we call it the medial, we call it the lateral, right? তাহলে anatomical position এ এইবারে দেখো ইম্পর্টেন্স অফ anatomical position. If we put in this, it will not be true. In anatomical position, this border is medial or this border is lateral? This border. কিন্তু যদি এখানে এরকম করি, যে কোনো আমরা যদি রেফারেন্স না করি অ্যানাটমিক্যাল প্লেনে, তাহলে এটা তো মিডিয়াল হয়ে যাবে, এটা ল্যাটারাল হয়ে যাবে, হবে না। অ্যানাটমিক্যাল পজিশনে once it is medial, so this side is always medial. So this is the medial, this is the lateral, and this is the axial line of the superior extremity. But in comparison to body, main body axis, it is the medial, it is the lateral. Clear hoyeche? So it is the medial side, it is the lateral side. Clear hoyeche? Clear? Medial lateral, কিন্তু medial lateral মানেই দুটো জিনিস আছে, একটা জিনিসে medial lateral হবে না। আচ্ছা, নেক্সট হচ্ছে proximal and distal, which is very close to the central axis of the body, central part, এটাকে বলি আমরা proximal। আর যেটা away from the central part of the body in anatomical position, it is the distal. So ভালো করে বোঝো comparison, this is the elbow joint, elbow, so elbow is distal to the shoulder, তাই তো? ক্লিয়ার হয়েছে? Elbow is distal to the shoulder, but here elbow is proximal to the wrist. ক্লিয়ার হয়েছে এটা? এই এলবো একবার প্রক্সিমাল একবার ডিস্টাল, কম্পারিজন ডিফারেন্ট কম্পারিজন হলে this elbow joint is distal to the shoulder joint, this elbow joint is proximal to the wrist joint. এবারে বলো এইটা is proximal and distal to the wrist joint? হ্যাঁ, distal, ক্লিয়ার হয়ে যাচ্ছে। এইবারে বলো whether it is a medial or lateral? হ্যাঁ, lateral, দো আমি এরকম রেখেছি, it is lateral, right? আচ্ছা, এইবারে একটা বলি, সুপিরিয়র এক্সট্রিমিটিতে যেহেতু এই মিডিয়াল সাইডে আলনার বোনটা থাকে, এইখানটায় আলনার বোন থাকে, এই বর্ডারটাকে আমরা মিডিয়াল বর্ডারও, উই ক্যান সে ইট ইজ এ মিডিয়াল বর্ডার অর এ আলনার বর্ডার, সেম থিং। And lateral side, the radius bone is situated. So this border, we call it radial border or lateral border. Come on. আচ্ছা, এবার হচ্ছে cranial and caudal. Those move towards the Cranium means head. We call cranial, and away from the cranial, away from the head, we call it caudal. Caudal means ledge. তাহলে this part is, যদি compare করো, এইখানটায় ট্র্যাকিয়া রয়েছে, এখানটায় রয়েছে ধরো স্টমাক। তো trachea is cranial to the stomach. Just, it is not so important, it is important in embryology. আচ্ছা, এরপরে মোস্ট ইম্পর্টেন্ট জিনিস সেটা হচ্ছে সুপারফিশিয়াল অ্যান্ড ডিপ। হোয়াট দিস ম্যান, যেহেতু ডিসেকশন not always done in anatomical plane, operations not always done in anatomical plane, so we have to have got another idea what is anterior, maybe posterior. ধরো আমি ডিসেকশন একটা অপারেশন করছি এইখানে, it is now superior, আবার এরকম করে করলে এই সাইডটা superior, anatomical position তো পাল্টে যায়। তার জন্য we have to know the idea of superficial and deep. Again it is a comparison. Any structure close to the skin, we call it superficial, and deep to the skin, we call it deeper, deep. ব্যাপার কি হলো? If we do a dissection here, first we cut the skin, then we cut a connective tissue called the fascia, then we got the muscles, etc., then we find the bone. তাহলে কি কি পাচ্ছি আমি? এখানটায় যদি ডিসেকশন করি, এখানটায় দেখি আমি চারটে নিয়েই বলছি, বেশি কমপ্লিকেশন করছি না। এটা স্কিন, এটা ফাসা। ফাসা হচ্ছে একটা লুজ লাইক এখানে থাকে, কাটলেই দেখা যায়, পরে শিখবে। এটা হচ্ছে মাসেল, এটা হচ্ছে বোন। তাহলে এবারে বলো, এটা হচ্ছে স্কিন, which one in comparison to the muscle and fascia, which one is superficial? হ্যাঁ, in comparison যদি দুটোর মধ্যে তুলনা করি, fascia and muscle, which one is superficial? Fascia. Which one is deeper? Muscle. So muscle is deep, এটা হচ্ছে superficial. আমরা যদি ফাসা আর বোনসে কম্পারিজন করি, which one is superficial? ফাসা। বোনস ইজ ডিপার। এরপরে আমি কম্পারিজন করছি মাসেল অ্যান্ড বোনসের মধ্যে। ইফ ইউ কম্পেয়ার মাসেল অ্যান্ড বোন, which is superficial? Which is superficial? Muscle. তাহলে previously muscle was deeper in comparison to fascia, তাই তো? Now it is become superficial in comparison to bone. So all are relative, আপেক্ষিক। তাহলে আমরা এটা কি লিখতে পারি? Muscle is deeper to the fascia but superficial to the bone. Is correct? যদি আমরা বলি bone is superficial to the muscle, correct? Bone is superficial to the muscle. Yes or no? Correct or not? Not correct. তাহলে আমরা যদি এভাবেই করি আর ওভাবেই করি, যেটা স্কিন কাটলে আসবে সেটা সুপারফিশিয়াল, তারপরে ওটাকে কাটলে আসলে সেটা হচ্ছে ডিপ। So when we cut the skin, the structures we found, it is the superficial. Then we cut the structure, find another structure, we call it deep. Clear hoyeche? So this is another type of nomenclature, superficial and deep. তাহলে এখানটা হচ্ছে, this is the fascia, it is superficial to the muscle and also superficial to the bone, and bone is deeper to the muscle. আচ্ছা, laterality, এইটা যদি only one leg হচ্ছে, একটা এইটাকে বলি midline এবং এইটাকে বলি lateral side. Medial and lateral, I have told you what is medial, what is lateral. Suppose one limb is involved, inferior extremity, we call it unilateral, one side. If both the limbs are involved, we call bilateral. যদি same sided limbs superior and inferior involved হয়, we call it ipsilateral. Ipsilateral, one side. যদি এই সাইডের রাইট সাইডের ইনফিরিয়ার, লেফট সাইডের সুপিরিয়র এক্সট্রিমিটি ইনভলভড হয় কোনো কারণে ডিজিজে, উই কল ইট কন্ট্রাল্যাটারাল.